Today we will talk about the general physical examination. Before starting the GPE, first of all you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of general physical examination to the patient and make him or her comfortable. Always approach the patient from the right side and expose the patient in the proper positioning for the GPA sitting position or the supine position. So the first step in general physical examination is inspection of the patient. In inspection, first of all, note the appearance of the patient, whether he or she is well looking or ill looking, whether the patient is conscious or unconscious. Also note the alertness of the patient and orientation of the patient with respect to time, place, and person. Also note the body build, whether the patient is average build, whether he or she is tall, thin, lean, or obese, and also note the color of the patient, whether he is cyanos, pale looking, or erythematous or not. The next one is the decubitus. And decubitus note the patient setting, posture, and attitude. Like a patient with a severe heart failure will try to sit proper because his dyspnea worsen on lying flat. And the last one is the environment. In environment, we look for any connection to the patient, like any IV line attached, catheter pass, oxygen mask attached to the patient or not. So the mnemonic for the inspection is A, B, C, D, E, in which the A stand for the appearance of the patient, B for the body build, C for the color changes, D for decubitus, and E for environment. The next step in GP is a palpation. And palpation, first of all, we check the vital sign, and the vital sign include temperature. So check the temperature with a thermometer. And next is the pulse. So measure the pulse and note the rate of the pulse, rhythm of the pulse, volume of the pulse, and any delay. If the pulse is less than 60, it is called as bradycardia, but if it is more than 100, it is known as the tachycardia. And usually we check the radial pulse or femoral pulse. Next is the respiratory rate. So also measure the respiratory rate. Normally the respiratory rate ranges from 12 to 16 beats per minute. And also measure the blood pressure. The normal blood pressure is 120 by 80 mmHg. The next one is the anthropometric measurements. So the anthropometric measurements include height. So measure the height of the patient. Also measure the weight of the patient. And children measure the occipital circumference. And at the end measure the BMI of the patient. And the BMI is calculated as mass in kilogram divided by height in meter square. And the normal BMI ranges from 18 up to 25. Next step is the head to toe examination of the patient. So the first one is examination of the hands. So the hands include changes in the nails. So the nail changes include clubbing. Clubbing means the loss of angle between the nail and the nail bed, and it occurs because of the swelling of soft tissues around the terminal phalange. And clubbing is seen in chronic lung disease like CA lung bronchiectasis, fibrosing alveolitis, cyanotic heart disease, infective endocarditis, Crohn's disease, ulcerative colitis, and malabsorption syndrome. Similarly, the next one is the chylonychia. Chylonychia means the spooning of nail, and it is the characteristic feature of iron deficiency anemia. Also, look for the splinter hemorrhages, which are seen in the infective endocarditis. Similarly, also look for the peripheral cyanosis in the nails. The nail become bluish in color, and it indicates hypoxemia. And also check the capillary refill time. Similarly, also look for the leukonychia, which are the white patches in the nail, and they are seen in hypoalbuminemia. And also look for the nails pitting. The nails pitting is seen in psoriasis. So the changes in the nails include clubbing of the nail, chylonychia, splinter hemorrhages, peripheral cyanosis, capillary refill time, leukonychia, and the nail pitting. Next one is the examination of the palms. So in palms, look for the pallor of the palmar skin, which is seen in the anemia. Also look for the palmar erythema, which is seen in the hepatic failure, rheumatoid arthritis, and pregnancy. Similarly, also look for the palmar sweating, which is seen in thyrotoxicosis and anxiety. Also look for the dupuytrenine contractures which are seen in alcoholic cirrhosis, and the picture is given here, which indicates the dupuytrenine contracture. Similarly, also look for the muscle wasting in the palms, and also look for the genuine lesions. Next is the examination of the fingers. So in fingers, look for the osler nodes. Osler nodes are the pea-sized painful swelling which are seen in the pulp of terminal pharynges, and it is seen in the infective endocarditis. Also look for the Heberden nodes and Bocher nodes, and both of them are seen in osteoarthritis. But Heberden nodes indicate the bony swelling of the terminal interphalangeal joint, whereas the Bucher nodes it indicate the bony swelling of the proximal interphalangeal joint. Similarly, in rheumatoid arthritis, the changes in the hand include anterior subluxation, swan neck deformity, buttonhole deformity, and Z deformity of the thumb. And also look for the echinodactyly, which are the thin and long fingers seen in the Marfan syndrome, which is a connective tissue disorder. Next one is the examination of head and neck. The first one is the changes in the pace. So in the pace, look for the moon-like pace, which is seen in the Cushing syndrome. Also, look for the mask-like pace. Mask-like pace means expressionless pace, which is expressionless pace, which is seen in the Parkinson disease. Also, look for the butterfly shape rash, mostly in the children's, which is seen in the systemic lupus erythematosus. Also look for the Malabash, which is seen in mitral stenosis due to congestion of the blood. Also look for the color of the skin. The bluish discoloration of the tip of nose and ear lobule indicate cyanosis. Similarly, also palpate the parotid gland for any visible swelling or lump, and also look for the signs of hirsutism on the face in female, which are present in polycystic ovary syndrome. Next one is the changes in the eyes. So in eyes, look for the pre-orbital edema, which is seen in glomerulonephritis and the renal failure. Also look for the exophthalmos, which means the protrusion of the eyeball, which is seen in hyperthyroidism, specifically the Graves' disease. Also look for the jaundice, and the jaundice note the color of the sclera, and the color of the sclera become yellowish and jaundice. Anemia, check the pallor of the lower conjunctiva, because in anemia the lower conjunctiva they become pale in color, whereas in jaundice the sclera, which is the yellowish which is the whitish part of the eye, it become yellowish in color. And similarly also look for the xanthelasmas, which are the yellowish plaques present on the eyelid, and they occur in the hyperlipidemia. Next one is the changes in the mouth. So in mouth, look for the oral dental hygiene. Also, look at the inner side of the lower lips for papal cyanosis and the tongue for central cyanosis. Similarly, also look for any visible ulcer, enlarged tonsil, or signs of the glossitis, and also look for the jaundice on the undersurface of the tongue. But in most of the cases, the jaundice is noted in the sclera, which become yellowish. Next one is the changes in the neck. So in the neck, look for any visible swelling or lump. Similarly, also palpate the thyroid gland on both sides by asking the patient to swallow. Similarly, also palpate the carotid pulse, which is located on the anterior border of the sternocleidomastoid muscle. But note that the carotid pulse is palpated unilaterally. Do not palpate the carotid pulse bilaterally at the same time. Also measure the jugular venous pulsation, and similarly also auscultate the neck for any vascular buoy, which is seen in the vascular lesion. And children, look for the BCG scar on the right deltoid muscle. The next one is the changes in the lower limb. So in the lower limb, look for the skin changes, muscle wasting, and the hair loss. Similarly, also look for the edema. So in the lower limb, the edema is checked behind the medial malleolus, dorsum of the foot, and in front of the shin or the tibia, and examine whether the edema is spreading or non-spreading by pressing over the area for 5 seconds with your thumb. And pitting edema, when you press over the swelling, a pit is palm, and the pitting edema may be generalized bilateral, which is seen in right-sided heart failure, pericardial effusion, constrictive pericarditis, renal failure, nephrotic syndrome, and the liver cirrhosis, whereas the localized pitting edema it is seen in the cellulitis and venous obstruction. Similarly, also, check the non-pitting edema, and the non-pitting edema is seen in lymphatic obstruction, like which occur in filariasis, surgical removal of the lymph node, angioedema, and myxedema. And similarly, also examine the pre-sacral edema, which is seen in the heart failure, post-pelvic surgery, and pelvic inflammatory diseases. At last, palpate the lymph nodes, and lymph nodes include submental lymph node, submandibular lymph node, preauricular lymph node, postauricular lymph node, occipital lymph node, cervical lymph node that include both the anterior and posterior cervical group of lymph nodes, and the supraclavicular lymph nodes. So in the diagram, this area indicate the submental lymph nodes. These are the submandibular lymph node. These are preauricular lymph node. These are the postauricular lymph node, and posterior is the occipital lymph node. Anterior to sternocleidomastoid muscle is the anterior cervical lymph node, and posterior is the posterior cervical group of lymph node. And these are the supraclavicular and the infraclavicular lymph nodes. Similarly, also palpate the axillary group of lymph nodes, and these lymph nodes include the lateral group, the medial group, the anterior group, posterior group, and the apical and central group of axillary lymph node. And similarly, also palpate the lymph node in the groin area, and also check whether these lymph nodes are mobile or fixed, and also check the consistency of the lymph node also. At the end, cover the patient and say thanks to the patient. So it was all about the general physical examination.